The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning, everyone, and welcome to Pain Free Today. I am your host, Denis Thompson. I'll be with you for the next hour, and we'll be talking and answering many questions from listeners throughout the world. But first off, for those of you who are not familiar with neurotherapy, the ARP Wave System neurotherapy, to kind of give you a thumbnail sketch of exactly what this therapy is and how it should and could be used. And I know we have many medical practitioners listening. We have many potential patients listening. So I'll kind of give a broad-based evaluation of what neurotherapy really is. First off, let's talk about what it isn't. It is not physical therapy. It's not occupational therapy. It's not anything to do with any type of current medical therapy that we use for soft tissue injuries. Neurotherapy is a therapy that's founded on the principle that every single condition that you would ever experience as a human being has a neurological origin. So in other words, to make it simple, wherever you have pain is where the problem ended up. It is not where the problem is coming from. Example, if you have elbow pain or wrist pain or any type of joint pain, that's a classic indication of where the problem ended, not where it's coming from. Now, to compound that problem, all of the testing that we primarily do, which would be either a CAT scan or an ultrasound or an MRI or an X-ray, all of those tests and images tell us exactly the same thing, where the problem ended, not where the problem is coming from. And what I mean by that is where the signal is coming from that's causing the pain or causing the restricted range of motion. So when you listen to the beginning of our show, we talk about how you can move freely without pain at any age. Well, it's very possible, provided we get rid of the neurological disruption which is causing us not to be able to move. So what neurotherapy is a brand new therapy dealing with purely the neurology of the pain, the neurology of the injury, or the neurology of the symptom. And it's just that simple. It is a neurological therapy, simply because everything that happens to you is controlled by your nervous system. So the therapy is designed to be used in addition to any other type of therapy. So if you're a practitioner and you're offering all sorts of physical therapy, occupational therapy, you have athletic trainers, you're doing any type of therapeutic exercise, this is a tremendous addition to what you're presently doing, because it addresses the side that the physical aspect of medicine does not address, and that, of course, is the neurological side. So the first thing that we do in a neurotherapy session is we have to identify, is the nervous system working correctly? If it is, then you'll pass the test. If it is not, you will fail the test. And approximately 85 to 90% of you listening today will fail that test, which means that the majority of you are unable to neurologically turn your muscles on fast enough to absorb force. And if your muscles cannot absorb force, that force is going to go to a joint, tendon, or ligament, and those tissues are not designed to absorb force. So consequently, you're either going to have pain, you're going to have an injury, or you've already had an injury, one or the other. So the first thing that we have to do in neurotherapy, and it's a three-part system, we must find out, is the nervous system sending the appropriate electrical signal to the muscles to allow the muscle to turn on fast enough to absorb force? If it is not, we have to then stimulate the nervous system so it fires the proper signal to the muscle to where that muscle now can begin to absorb force. So in our first step, we identify, is the nervous system working correctly? And if it is not, we make an adjustment to the nervous system. We stimulate the nervous system to fire the muscles. Just because your brain can't tell your muscles what to do does not mean an external brain can't. And think of our proprietary tools, our proprietary techniques as just that, external brain. And as that external brain is sending signals to your muscles to allow them to do what they're supposed to do, we are now going to be transferring the force out of the joint, tendon, or ligament into the muscle where it should have gone to begin with. Henceforth, you're going to be able to move a whole lot more freely with a whole lot less pain. So the first step in our system is to identify, is the nervous system working or not? Think of it as, is the switch on or is it off? If it's off, which in most cases it will be, we have to turn that switch back on. And we do that through step one of neurotherapy. Now, many of you were with us at the FIME show in Miami and saw this in action. Those of you who have not seen it in action, you will be literally amazed at how quickly you turn that switch on and off. And so the very first thing we do is we have to test. Is the switch on or is it off? If it's off, we have to turn it back on. So the second thing we have to do is we have to literally find out where the signal is coming from, which is causing the problem. And this is really hard for a lot of practitioners, very difficult for some patients to comprehend because they know where it hurts. And the practitioner knows where the MRI says the problem is. But that's exactly correct. That's where the problem is. That is not where the signal causing the symptom of restriction in motion or causing the symptom of pain is coming from. So in the second step of our system, our neurotherapy ARP Wave system, we have to identify where the signal is coming from, which is causing the problem. And we do that by utilizing our proprietary technology, which we now use as a diagnostic tool, and we scan your body to find out exactly where the neurological disconnect is. Now, for the practitioners listening, what we're looking for is sodium-potassium leakage. If we find sodium-potassium leakage, we know that we have a scar tissue area. And wherever we have scar tissue, we know that there's no cellular communication going on. So as long as we find that area where there's no communication going on, we now need to re-implement that communication channel. Now, since it's scarred off and walled off, that tissue is not going to be able to communicate correctly. So now we're going to use an external source to communicate directly to the muscle to tell the muscles to do what they're supposed to do, transfer the force out of the damaged tissue into the healthy muscle. And now, of course, we have very little pain and a whole lot of range of motion. So in step 2, we scan the body. And we anchor an electrode on one side of the body, and we take another electrode and we move the electrode around until we find an area where that current cannot penetrate that tissue, which is that wall. That wall is scar tissue. The minute we find that, we know exactly where the beginning of that trail is, which is causing the symptoms that we're basically treating. So, example, let's say that your elbow hurts, and you've been diagnosed with tennis elbow or golfer's elbow. And we put an electrode right on your elbow, turn up the power to our designated protocol, and you're going to feel very little. So we tell you, okay, now, based on that, that's where the problem ended. Now we're going to scan the body. So we're going to scan up and down your arm. We're going to scan up and down your legs. We're going to scan up and down your back. We're going to scan up and down your other arm, your other leg, until such time as we get to a point where that sensation, that little tiny sensation, goes up. And when it goes up, we basically know that that is where the signal is coming from. So we anchor an electrode there. We repeat that very same process with the second electrode, and now we have the beginning of the trail and the end of the trail, which is causing the physiological symptom. And until we find that trail, no amount of therapy is going to facilitate a change. That's why it takes so long to come back from soft tissue injuries or post-surgical intervention, is because we're constantly working on where the problem ended, not where it's coming from. Think about it this way. Every time you have surgery, or any time you've had surgery, you had surgery on where the problem ended up. You did not have surgery on where the problem is coming from. And until you find out where that problem's coming from, you stand a very, very good chance of having another surgery in the not-too-distant future. Why? Because you've done absolutely nothing to solve the problem. All you did is fix where the problem ended. You did not fix what caused the problem. So neurotherapy is designed to identify where that problem originated from, and it's always a neurological disconnect to the muscles to allow the muscles not to do what they're supposed to do. Henceforth, you need surgery and or have pain and or have restricted range of motion. So now once we get to step 2, we then go to step 3, which is basically treating you and getting your body able to absorb force. I hear our music, and we'll be right back, and we'll talk a little bit about how that treatment works. Listen carefully to how you can try this with no cost and no obligation to you.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com. neurological.com and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back. This is your host, Denis Thompson. You're listening to Pain Free Today. And for those of you in the Orlando area, we will be in the Orlando area on Thursday, Friday, Saturday, and Sunday at the Florida Chiropractic Association. And if you would like to see the ARP Wave System neurotherapy in action, please give us a call, and we'll make sure that you're able to get into that show. The telephone number to call is 954-256-0045. Now, we met many of you in Miami. Now we have another chance to meet the folks in the Orlando area. And if you'd like to come to the show, if you would like to meet me in person, if you would like to be treated by myself or any of our other doctors there, please give us a call at 954-256-0045. And we'll be happy to get you into that show. For the doctors listening, we would love to meet you at the show, demonstrate for you the efficacy of this system, and show you what a tremendous benefit this could be to your practice by adding neurotherapy to your practice. This is something that does not replace what you're doing. It just simply adds to what you're doing. And it adds a completely different avenue of treatment. And that treatment, basically, as we stated earlier, is all neurological. So when we're doing the treatment, why is it so important to go through the number of sessions that we have as a treatment, which is basically 20 sessions? And the answer to that question is very simple. If you have the opportunity to have your first no-cost, no-obligation treatment, you'll see instantaneously a change in the way you feel and a change in the way you move. Unfortunately, that change is going to last only about an hour and a half to 2 hours, and there's a reason for that. And that is that your muscles are used to being in a certain position. We call that concentric contraction, where they're protecting you. What we do in the very first session is we neurologically send a signal to the muscle to allow it to go from a protected state into a stabilizing state. And if you'd like to know what that really means, concentric contraction is like having your fist closed. An eccentric contraction, which is a stabilizer contraction, is like having your hand open. And what we do is we immediately, what you would call, relax the muscle, which muscles don't really ever relax. They either contract by shortening or they contract by lengthening. They don't relax. So the relaxation of the muscle, or the getting the muscle out of a spasm or out of a concentric contraction into an eccentric contraction, is immediate. And it usually happens within a minute. Now, that first session will last about an hour and a half to 2 hours, and then the muscle wants to go back to where it's been, because it's been there for a long, long time. So we call that homeostasis. What neurotherapy is all about is neurologically reprogramming those muscles to stay in the position that they should be in, which is eccentric contraction multiplied with concentric contraction, so giving you a free-flowing motion. So what happens is, the reason you need to go through therapy is because every single day we're extending the period of time that the muscle does what it's supposed to do, which is stabilize you, not protect you. So the longer it stabilizes you, the less pain you have and the greater range of motion you have. So let's say on day one, you come in for your free evaluation and treatment, and an hour and a half, 2 hours later, you start to tighten up again and start to feel that pain. Probably a little bit less, but you'll still feel that pain. And then the next day, you come in and you do the very same thing. And let's say that day one, you were without pain or able to move more freely for about an hour and a half. Day two, we'd expect that to be 3 hours. Day three, 4 to 5 hours. Day four, 5 to 6 hours, and so on and so forth. So by the end of 20 sessions, we've completely neurologically re-educated your muscles and your movement pattern to where you will never have those issues again. But it does take 20 sessions because more than likely you've had the problem for a whole lot longer than 20 days. So if you've only had it for 20 days, then it might be a little bit shorter, but my guess is you've had it for a little bit longer than 20 days. So we just have to re-educate, neurologically re-educate those muscles to do what they are supposed to do. Because if they can't do what they're supposed to do, the force is going to be going to tissue that is not designed to absorb. Now, if you'd like to see that firsthand right now, you can do that. Very simple. If you have knee pain, stand up out of a chair. If you're laying down, stand up, and you probably felt pain in your knee. Walk around, you probably feel pain in your knee. Why? Because the muscles above the joint line and below the joint line are not doing what they're supposed to do. They're supposed to absorb force. They're supposed to be acting like a shock absorber. If they're not acting as a shock absorber, the force is going to go to your knee. Now, force is not supposed to go to your knee, but if you have pain in your knee, I can guarantee you that force is going to your knee. Now, if you want to see how to redirect that force very quickly, very simple. Just stand up, go over to a door, open the door, grab one handle with one hand, grab another handle with the other hand, and now keeping your upper body perfectly erect and your arms fully extended out in front of you, to where your right hand is on the inside door handle and your left hand is on the outside door handle, and the door is partially open and you're standing right in front of the door. Now what I want you to do is sink down as though you're sitting in a chair, but make sure that under no conditions does your knee go forward of your ankles, because if it does, you're transferring the force to your knee. If the knee is behind your ankles, you're transferring the force to your hamstring and your glutes. Now try that, and I can guarantee you that the pain that you had walking over to the door is not present when you're in that position, and more than likely you'll be utterly amazed that you can get into that position because you haven't been into that position for many, many years. Why? Because it hurts. Why does it hurt? Because you're getting into the position totally incorrectly. We get to that position by utilizing the hamstrings to pull us down and keeping the force out of the knee. That's just a simple, very, very simple solution. Transfer the force. Now, if you want to know what that feels like if you don't have a knee problem, just grab a hold of your hand and put it into a fist, and then pull your arm up to where your fist is pointed toward your shoulder, so you're flexing your bicep. And just flex that bicep for about the next 2 minutes. And in that 2 minutes, that bicep is going to start to get really tight, start to get sore, and some of you might cramp and some of you might have pain there. That's what's called concentric contraction. So what we have to do is, to get out of that pain, we have to go the opposite direction. So now, after 2 minutes, just straighten out your arm and see what happens. The second you straighten out your arm, there's no more pain in your bicep. Why? Because the tricep elongated perfectly to get your arm straight. That's what it should have done before. But in your case, it didn't. So that's an easy explanation of what you will actually experience in one of our neurotherapy sessions. We're dealing with the neurological software that drives your physiological hardware called your muscles. And everyone else up until this point in time probably has been addressing your hardware. your body. Your body is not the problem. Your body is where the problem ended up. Your software, the nervous system, is what is causing the muscles not to do what they're supposed to do. So if you work on the hardware and it's a software problem, you are not going to solve the problem anytime soon. But if you work on the software and it's a software problem, you're going to solve it very quickly. And I mean in minutes. Not days, hours, weeks, or months, minutes. You're going to see a difference. Why? Because you've changed the neurological signal going to the muscles to allow the muscle to do what it's supposed to do. So, in our therapy, the therapy is designed to basically give you a stimulus, force you to move correctly. So, in other words, if you have knee problem, we're going to have you stand up and sit down 5 times. The first time you do it, you're going to do it incorrectly. The second time, you're going to be about 25% better. The third time, you're going to be 25% better. And on on repetition number 4 and 5, you're going to be perfect. And then what we're going to do? We're going to raise the stimulus. Now, you're going to go right back to your old habit. And this is exactly what we do every single session. We elevate the stimulus, we break your habit at that stimulus, and then we go to another stimulus. And we keep going and going and going until we have completely neurologically re-educated you on how to move efficiently and your muscles on how to absorb force. Because one without the other does not solve the problem. Example. If you have pain in your knee and you get a shot in your knee and you don't feel your knee, it didn't stop you from limping. Why? Because your brain still knows there's a problem there. So it's going to react and send the signal to the muscles and you're going to move incorrectly. With this therapy, we're going to completely neurologically re-educate you on how to move efficiently and get rid of any compensation patterns, and your muscles how to turn on fast enough to absorb the forces coming into the muscle to where the force does not go into the joint, and if the force is going into the joint, you're going to have pain. So what we're going to do in the therapy is redirect the force out of where it's bothering you into where it shouldn't bother you. And by doing that, you're going to have no pain and freedom in range of motion. Now, listen carefully to how you locally can try the ARP Wave System neurotherapy with no cost and no obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Denis Thompson. We have a few more minutes here together. And in the first 2 segments, we discussed what neurotherapy, the ARP Wave System neurotherapy, is and how it works. And now what I'd like to do is answer some questions and talk a little bit about some different conditions that people were interested in finding out how neurotherapy could help them. If you're a provider, let me also reach out to you because, again, we're going to be in Orlando this week at the FCA, the Florida Chiropractic Association, and we'll be there Thursday through Sunday. If you'd like to set up an appointment with us, if you'd like to get into the show, if you'd like to have one of your patients, you or one of your patients treated, please give us a call, 954-256-0045, or you can contact us on the net at painmanagementnetwork.com. That's painmanagementnetwork.com. And we'd love to have the opportunity to meet you and introduce you to neurotherapy and talk to you about becoming part of our provider network. And we are setting up the nation's largest network of providers who offer ARP Wave System neurotherapy to all of their patients, in addition to what they're presently doing now. So that would love to have the opportunity to demonstrate that for you. This weekend, I had a fantastic conversation with a world-renowned maxillofacial surgeon. And we talked about TMJ and we talked about TMD. And we talked about all of the different means and mechanisms by which we typically address these issues. And many of those were splints and bracing and shots, and when it comes down to it, the last and the worst case scenario would be surgery. And when we look at TMJ, and we look at it through a neurological light, not a physiological light, because if you look at it in a physiological light, obviously the patient has got pain. They can't open their mouth. They have a variety of different types of patterns, grinding the teeth, and a variety of different things that create problems. And many dentists will tell you that it's a very, very large problem. And then one of the byproducts of TMJ is headaches and tight muscles and tight neck muscles, et cetera, et cetera, et cetera. So when we look at that, let's look at it in now a completely different light. And this is exactly what we discussed in this conference with this surgeon. And I thought it was a fantastic conference that we had. And one of the things that we addressed was that the typical patient does not need surgery. The overwhelming number don't need surgery. Surgery is simply a last resort. And what we have to do is we have to break a pattern. And to break that pattern, no matter how many times you do it, you know, this surgeon was saying that it probably takes 10,000 times opening and closing your mouth in a very distinct way before you're going to break the pattern. Well, let me ask you a question. How many people do you know that are disciplined enough to open and close their mouth 10,000 times in a therapeutic environment? I can tell you that the majority are not going to do it simply because it's a tedious task. So why do you think it takes, and this surgeon is world-renowned, why do you think it takes 10,000 times? Why do you think he picked that number? Because that's what he believes is necessary to create a new pattern. 10,000 times. As I explained to him on the telephone, with our proprietary technology, we can get the same effect of those 10,000 times of opening and closing your mouth in a very distinct manner. We can get that very same effect. Now, when you're contracting your muscles at 10,000 times, we'll just say that that's going to be about 20,000 contractions neurologically. So 10,000 times 2 contractions per second. So it's going to be roughly about 20,000 contractions. With neurotherapy, in 1 minute, we can get 20,000 contractions. So you can see that it's going to dramatically shorten down the time that it takes to recreate a new pattern. And what is that new pattern? If you're a maxillofacial surgeon listening to this, if you're a dentist listening to this, and you have a patient who cannot open their mouth more than 1 finger, in less than 10 seconds, their mouth is going to open probably 2 to 3 fingers. It's not a miracle. It's not a panacea. It's not snake oil. What it is pure, simple physiology. Send a signal to the muscle that is tightened down and relax that muscle, allowing it to unwind, so to speak, and the mouth is going to open up. It's just that simple. Now, the problem is it takes repetition upon repetition upon repetition to do that. So just as we said earlier, for the other conditions, like the knee condition, we have to break that pattern. Now, that pattern's been there for a long, long time. So the very first time we treat someone with TMJ or TMD, they're going to be able to open their mouth almost immediately. They're going to have virtually no pain. They're going to have no clicking of the jaw necessarily, as loud as it has been in the past, and it's going to be a freedom that they haven't had for a long, long time. The trouble is, they've been in there a long, long time, so consequently that muscle is going to go right back to where it feels comfortable, and the pattern of the way they chew food, move their teeth around, move their jaw around, is going to create that. That is a neural pattern. It has nothing to do with the way the teeth are positioned, et cetera, et cetera. It's a pattern. And your brain says, move this way, it feels better, move this way, and it's going to hurt. So which way are you going to move? Where it doesn't hurt. So you create this new pattern. Unfortunately, that pattern is out of alignment with how your jaw is supposed to be operating. So consequently, the force that's supposed to be going into your muscle now is not going into your muscle, and now you got a major problem on your hands. So what we do is we break that pattern. So the first thing we do is we test to see is the nervous system working correctly. If it is, great. If it isn't, we got to turn that switch back on. Remember, that's step 1. Then step 2, what do we have to do? Step 2 is we have to basically redirect that force. We got to get the muscles to do what they're supposed to do. We got to get the muscle to be able to relax enough to open your mouth. Well, how do you do that? You take the muscle from concentric contraction to eccentric contraction and then reinforce it with a movement pattern such as opening your mouth. And when you do that, amazing things happen. A, you can move. B, you can get your mouth open further than you ever thought you could. And more importantly, there's no pain. So your cognitive brain says, wait a minute, I can now do this and it doesn't hurt. So now you're going to do it. And you're going to do it for about the next hour and a half to 2 hours until your cognitive brain says, oh, wait a minute, that starts hurting again. And now you're going to go right back to your old pattern. So the reason you need to go through therapy is to create a new neural pattern, and that new neural pattern is going to allow you to do things you presently cannot do. But after we treat you once, and again, what we're saying sounds way too good to be true. What we said to the knee patient sounds way too good to be true. What we say to the practitioner sounds way too good to be true. There's only one way you're ever going to know if what I'm saying is true and will work for you. Because I'm not saying it works on everybody. I'm not saying it's a panacea. I'm not saying it's a miracle. It's not. It's not any of those. But I am telling you that over 75,000 patients, 95% of the time it worked. Now, that's a pretty good odds. So my guess is that 95% of you can get help. Way more than you think you're getting right now. So you got nothing to lose and everything to gain, whether you're a provider or whether you're a patient. Just give us a call. Give us a call at 954-256-0045. 0045 and tell us what your situation is. We'll ask you to ask your doctor if they would be interested in having you treated in their office by our system, and we'll arrange that at no cost to you or no cost to the doctor. Now, if your doctor says, no, I don't want to be bothered by it, don't know too much about it, whatever. If your doctor doesn't agree, we have plenty of doctors who would be more than happy to allow you to try the ARP Wave System neurotherapy at no cost and no obligation. But we would like to start with your doctor first. Because keep in mind, if your doctor sees what I'm saying is true, and you see what I'm saying is true and works for you, then two things are going to happen. Number one, you're going to be able to get the care that you need. And number two, we're going to get another provider to offer this service to all of the patients who are in desperate need of addressing all of these issues. Keep in mind, the average person has pain somewhere. Think about that. The average person has pain somewhere. Now, why do you suppose that is? Well, I believe it's because the average person has no ability to absorb force neurologically, so therefore the neurological muscle conditioning is not being done, so the muscles have no idea what to do. They cannot absorb force, and consequently you're going to have force transferred to tissue that it's not designed to do that job with. And when that happens, you're going to have pain. It's just that simple. So if you have any pain whatsoever, if you have a restricted range of motion, if you've been told you need surgery, if you've had a surgery that didn't work, if you've had a surgery that's taking too long to recover from, give us a call. Please give us a call. Let us have the opportunity to introduce you to neurotherapy. 95% of the people who try neurotherapy are going to see a change. But the only way you're ever going to know if this can help you is to try it. And if there's no cost, there's no obligation, and there's no risk of injury, why in the world wouldn't you try it? So listen carefully to how you can try the ARP Wave System neurotherapy for yourself.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back. This is your host, Denis Thompson. You're listening to Pain Free Today. And in the first three segments, we've been talking about the ARP Wave System neurotherapy. The last session, we talked a little bit about TMJ and TMD. I constantly get emails pertaining to chronic pain. Chronic pain characterized by things such as CRPS, which used to be called RSD, things like fibromyalgia, things like chronic pain syndrome. And the question is always the same. What will the ARP Wave System neurotherapy do for chronic pain? And as I consistently say to everyone, I'm not a doctor. We're not here to prescribe. We're not here to diagnose. But what I can do is tell you what the results for many patients have been who have these types of conditions. So in no way am I telling you and giving medical advice. What I'm doing is just simply relating stories of patients. We call those anecdotal studies, patients that have had chronic pain, that have been treated with neurotherapy by our practitioners throughout the world, and what the net result was. And that net result is that 95% of them feel better. 95% of them have what I call mobility pain, which is pain of 1 to 3. Anything above 1 to 3 is non-mobility pain. In other words, you're going to stop moving and have an active lifestyle. But you can easily have an active lifestyle with pain level of 1, 2, or 3 out of 10. And we can pretty much assure 95% of the people that we can get you to that position. So let's talk about chronic pain and how the ARP Wave System neurotherapy addresses chronic pain. And you'll see, if you've been listening to these shows for a number of weeks, you'll see that everything starts with the system. We never deviate from that system one iota. The very first thing that we do is step one of the system. Whether you have chronic pain, whether you have a broken arm, whether you have, whether you're asymptomatic and want to do athletic training, we start everyone by checking to see, is the nervous system doing what it's supposed to do? Is it sending the appropriate signal to the appropriate muscles to act as shock absorbers? Because if it is not, if the nervous system is not firing those muscles significantly fast enough to where the antagonist and the agonist can absorb force, then we're going to have a problem, because force is going to be going to tissue it's not designed to go to. So the first thing that we have to do with a chronic pain patient is we have to identify, is the nervous system working or not? If it is, great. If it isn't, we got to turn that switch back on. So in step one of the ARP Wave system, we're going to be using our proprietary technology to identify very, very quickly what's working and what isn't working. And if the nervous system is not doing what it's supposed to do, we're going to be using our proprietary technology to turn those muscles on to where they can absorb force and transfer the force out of the area that is bothering you. So that's step number one. Step number two is scan the area that bothers you. So let's say you have back pain, which is a very, very common problem. And let's say you've been diagnosed with any kind of diagnosis you can imagine, but the bottom line is you have back pain. And it's chronic. It's there 24/7, 365. Doesn't make any difference if you're laying, sitting, standing, walking. You have pain. Ask yourself why. And until you can answer the question on why, you'll never solve the problem. And the answer why is not coming from a test. The answer why is not going to be coming from any existing technology that we use as far as a diagnostic tool, because those tools all answer the question where. And you already know where it hurts. It hurts in your back. In this case, we'll talk about back pain, chronic back pain. Could be chronic pain anywhere. The rules are the same. So step one of the system is identify, is the nervous system working or not? If it isn't, we have to turn that switch on to get the muscles to do what they're supposed to do. In step two, we have to identify exactly where the origin of the signal is coming from that's causing the back pain. And it will definitely not be your back. That I can almost guarantee you. So how do we do that? Well, we use our proprietary technology, our proprietary tools, our proprietary techniques, and we scan looking for where that signal is created by a short. In other words, we're like an electrician. We're looking for an electrical short. Once we find the electrical short, we find the beginning of the short and the end of the short, then we begin treating it in step two. So let me ask you a question. If you were a television set, or you were a computer, and you have an electrical short, does the TV work? Does the computer work? The answer is no. Well, we believe the body's the same way. If there's an electrical short, your body is not going to work the way it's supposed to work. And the outward expression of your nervous system are your muscles. So that means your muscles aren't going to be able to do what they're supposed to do, which is act as shock absorbers. And if you can't absorb force going into your muscles, that force is going to go someplace it's not supposed to go. And if you have chronic back pain, I can guarantee you the force is going into your back. That's not where it's coming from, but that's where it's ending up. So do you honestly think working on your back is going to solve the problem? Obviously not, if you still have chronic pain in your back. So don't you think there might be a different way of looking at that? There is. And that's find out where the heck the signal's coming from and then change the signal. Transfer the force out of your back into your glutes, your hamstrings, and your quads, and I can assure you you're not going to have back pain anymore. But that sounds way too easy and way too good to be true. Well, it only took me 40 years to figure it out. And another 10 years of active treating patients before I knew, beyond a shadow of a doubt, that we could help about 95% of the people with chronic back pain, without drugs, without surgery, without pain pumps, without any of the things we presently use. Now your question is, well, why in the world doesn't my doctor know about this? Well, your doctor doesn't know about it because we haven't been telling your doctor about it. We've been doing this as a provider, and we've provided this service to 75,000 people. We are now, as a company, going out and setting up the nation's largest network of doctors as our providers. Those doctors could be chiropractors, osteopaths, naturopaths, surgeons, neurosurgeons, orthopedic surgeons, any medical practitioner, physical therapists, occupational therapists, athletic trainers. Anyone who is treating patients can be a provider of ours. So 2 years from now, hopefully, all the doctors will know about ARP Wave. They'll know about neurotherapy. Many of them will be administering neurotherapy. So let's get back to your chronic back pain. So once we identify exactly where the signal is coming from, and don't be surprised that signal might be coming from your legs, because in the overwhelming majority of back cases, we find the problem in the legs. People say, how in the world is that possible? Well, stop and think about it in a simple analogy. If you were a house and you're built on stilts, and I cut the stilts out from underneath your house, what happens to your house? It collapses. So if your legs can't absorb force, where do you think the force is going to go? It's going to go right to your back, or your shoulders, or your neck. That's the top of the line. Get to your back, it's halfway up. But it's definitely going to creep on up there. So if I work on your back with neurotherapy, we're not going to be all that successful. But if we work on the area where the signal is broken down, where there's an electrical short, and we change your movement pattern, and we transfer the force out of your back into existing muscles that should be absorbing that force, I can tell you we're going to be incredibly successful at helping you get out of pain. But again, it sounds way, way, way too easy, and it sounds way too good to be true. So there's really only one way you're ever going to know, and that's to try it. And because we know it sounds too good to be true, and because we've been doing this for years and years and years, we know the only way you or your doctor are ever going to believe what I just said is to try it and see it in action. So what I'd like you to do is, after this program, which will be about 4 or 5 minutes from now, pick up the telephone, call your doctor, and ask your doctor if you can be treated with neurotherapy in their office. If the doctor says, what's neurotherapy? You can tell them you heard about it on the radio. You can tell them to go to our website, painmanagementnetwork.com, or you can tell him to give our offices a call locally at 954-256-0045, and he can get all the information, or she can get all the information they want. The bottom line is, the only way you're ever going to know, the only way they're ever going to know if what I'm saying can work for you is to try it. And so offer the opportunity. And if the doctor says, no, I just don't want to do that, I don't want to be bothered with it, I don't know that much about it, then listen carefully to how you can get hooked up with one of our providers. We'd like to start with your doctor first, but if your doctor says no, listen carefully, and we will get you set up with one of our providers. Until next week, this is Dennis Thompson, your host. You've been listening to Pain Free Today.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.